Eating problems happen quite more often in people with ADHD than in those without. Sleep disturbances belong to some of the most frequent problems that patients with ADHD come to a psychiatrist with. This is a problem experienced by around 80% of patients. You could even say that nearly every patient with ADHD has some kind of sleep disturbance. And mostly patients come with problems falling asleep. They may also get up during the night several times even. They may sleep uneasy. They may have sleep apnea. They have problems breathing during the night. And sometimes they also have restless leg syndrome. These are not the only problems that happen to people with ADHD, but these are the most important ones. Sleeping problems in ADHD are studied by the team of Professor Coy in Amsterdam. They've been researching the problem for many years and have come up with very, very important papers on the subject. According to this group, they say that people with ADHD have delayed secretion of melatonin. Melatonin is a hormone that people secrete in their brains when the night comes. So when it's getting dark, our brain secretes melatonin, and it is a signal for our whole body that the night is coming and we should come to rest. Unfortunately, in patients with ADHD, melatonin is secreted a little bit later, usually a little bit later. I say a little bit, but in some patients, melatonin is secreted much later. So when people without ADHD start secreting melatonin in the evening, let's say at 9, people with ADHD start secreting it at midnight, at 1, 2, 3, 4, 5 or 6 a.m. They usually secrete melatonin later. But when they start secreting later, of course, the melatonin is secreted from, let's say, 3 in the night until 9 in the morning, 10 or 12 even, so noon. This results with the problems getting up during in the morning. So many people with ADHD have problems getting up from bed in the morning. Many children with ADHD have problems coming to school because they have problems getting up. As melatonin very strongly suppresses appetite, so people with ADHD very often do not eat anything or eat very little in the morning because they don't have hunger. And only in the afternoon, when melatonin is no longer secreted in the afternoon or sometimes late in the afternoon, people with ADHD start to come up with their hunger and they get hungry. And when you add impulsivity, which is, as you know, one of the symptoms of ADHD, you may get problems with eating. So you may have binge eating or bulimia or other eating problems. That's why eating problems happen quite more often in people with ADHD than in those without. So that's why, for example, when doctors have patients with eating problems, they should always think about ADHD. We already know that melatonin is a problem, or secretion of melatonin is a problem in ADHD. So is it possible to get treated for this problem? Yes, it is, and this is how ADHDers should be treated for their problems with the sleep. So ADHDers, most ADHDers, at least those who have problems falling asleep, should take melatonin. The original protocol of Professor Coy is quite difficult to follow because there are different doses of melatonin that people should take on different days and at different times. For a person with ADHD, that's impossible to follow. Of course, for a person with ADHD, doing something regularly in a regular fashion with different doses on different days, it's problematic. I guess nobody or very few people would be able to follow such a program. So I changed it a little bit, and right now I will tell you how I treat my patients with sleeping problems. And this protocol is quite easy, and it works in most patients. Not in all the patients, because the original protocol of Professor Coy is much better and will work with much higher proportion of patients. Like I said, unfortunately, it's quite complicated. So my protocol is, you should take, if you're an adult, you should take around 5 milligrams. You can start with 3 milligrams of melatonin, and you should take it regularly each evening at, let's say, 9 in the night or in the evening. So 5 milligrams in the evening, and remember to do it regularly. Melatonin is a hormone that regulates our sleep cycle. So we do not expect melatonin to make us fall asleep within half an hour or 1 hour. We expect melatonin to regulate our sleeping cycle within 1 or 2 weeks. In some ADHDers, melatonin works right away. They take it, and half an hour later they have to go to sleep, to bed, because they are sleepy. But we are not looking for this kind of action. We are looking for the regulation of sleep cycle. So we should wait patiently 1 or 2 weeks for the melatonin activity to kick in. So please remember to take it regularly. We should not take melatonin one day and then skip another day and again take it and not take it. It will not work like that, and you can harm yourself because, like I said, melatonin is supposed to regulate your sleep cycle, and it cannot regulate your sleep cycle if you take it, if you don't take it each day. In children, we usually start with 1 or 2 milligrams, and there are no guidelines because it's quite still. I wouldn't say that all the doctors all over the world do this melatonin treatment, but many of us do. Many of us specialists in ADHD, we do treat with melatonin. In different countries you will find melatonin in pharmacies without prescription. In Poland, for example, you don't need prescription to buy melatonin, but in other countries like Germany, you need a prescription for your doctor. Please do to your doctor and convince him or her to give you the prescription, and try to take melatonin 5 milligrams if you're an adult. In children, I usually start from the age of 2. If it's necessary, if parents tell me that their child has problems falling asleep or wakes up many times during the night, then we go to melatonin 1 or 2 milligrams. And like I said, regularly. If the child is 10, 12, you can go with the higher dose, sometimes even with younger children. So you should always adjust the dose. So you should start as low as possible, so 1 or 2 milligrams in the evening. If it doesn't work after a week or 2, you can increase the dose by 1 milligram, let's say, each 1 or 2 weeks, and you should come to the right results. I'm pretty sure about that. Like I said, I have over 1,000 patients with ADHD, and it usually works. It is very important to treat the problems with the sleep, especially in children, because if we don't treat it, children with ADHD will have lots of problems getting up in the morning, and they will be very sleepy during the class. This will make their problems with concentration much more problematic, much stronger, and that's why we treat them with melatonin to let them regulate the sleep cycle, and they should find it easier to get up in the morning. So please, don't forget about this. If we don't sleep well, we have much bigger problems with the concentration and with our temper regulation, let's say, during the day. So it really emphasizes our problems with ADHD during the day.